Well, good morning, everyone. And once again, welcome to another live this morning. And nice to have you come on with us. If you can say hello, even better. Even better. So how are you? Welcome to another Doctor is In podcast. And we want to say hello to our dear friends. Let's see who's going to come up number one on the hit parade. On my side here, guess what, Brahim? You're number one on the hit parade this morning. Lucille, right there. Janice from Brampton, how are you? And Kevin, there he is, the mayor from Oshawa. Shelley, Frida, and Lisa. How are you, Lisa? Good morning to you. Nellie, nice to have you on. And Brahim says he loves me. Well, I love you too, Brahim. Sandy, Chilliwack, British Columbia. Hi, Beth. In New Brunswick. Bonnie in Blenheim, Ontario. Sue, Manitoulin Island. Beautiful. God's country. Andrea, Niagara Falls. Judy, Diane, Peterborough, Ontario. Georgie, Halifax. Nova Scotia. Elaine, St. John's, Newfoundland. Karen, Coldwater. And Karen in Peterborough. How do you like that? 2 in a row. And how are you in St. Catharines? And Fran, there she is, from Orangeville. Nativity's on with us this morning. Ornella. Madeleine is in Kippawa, Quebec, saying hello. Mary. Gander, Newfoundland, and Maria's in Ottawa. Maureen, there you are. Boca Raton, Florida. Daphne, good morning. Gillian, how are you? From Calgary. Claudette, Sherry, Mississauga. Sharon, Kansas. Gary, Bolton, good morning. Carol, Brunswick, Georgia. How are you? And who is that there? I couldn't see. Cheryl, Denise, and Ornella says she's having her vitamin C. She's drinking her coffee. Dennis, Arlene, and Andrea says she was late. I was wondering where you were. Danny Lay, Cheryl, Joan, how are you? And from Blind River, Lori, Cambridge, Ontario. Brandon, that's right, Memorial Day in the United States. Well, happy Memorial Day to my American friends. Dave, Karen, Jean, and Nativity was in Muskoka. Almost in Sudbury. You're right, Nativity. You were close. Mara, Francis Marie. Hi, IT. From Unionville, Sylvia. Okay, guys, let's get to the questions. Yeah, you guys are saying hello to each other. I like that. Heather in Miramichi. Deb is saying, okay. Deb, I love the question. Can I explain, okay, what I'm looking for in blood work when it comes to your lipid profile? Okay? There's so much confusion out there. It's meant to be confused. Okay? Doctors don't even know how to read it. They get your lipid profile and they look for the wrong things, in my personal opinion. They've been taught cholesterol bad. Especially LDL. And like I explained to you guys several times a week, they're looking for love in all the wrong places when it comes to your lipid profile. What is important when it comes to heart disease? What's important? Your triglycerides and your HDL cholesterol. Those are the two most important markers in your lipid profile on your blood tests. Look at your triglycerides, look at your HDL. I'm not saying you can't look at everything else because it's right in front of you. But what does it mean? Total cholesterol, non-HDL, and all this, it's confusion on steroids. It's meant to confuse you, and it's meant to keep doctors prescribing statin drugs. A whole industry. The cholesterol hoax, I call it, industry. And do you think you're going to get rid of it? Well, good luck. And now they come up because I might as well answer everybody's question this morning that are asking. Karen is asking, okay, so it's not only Deb, Karen is asking. What are the risk factors in having high levels of lipoprotein A along with high triglycerides and low HDL? Well, I don't care about your lipoprotein A. I just don't. And Karen, you can't make me. And I'm glad you asked because I want you to ask questions. I am here to teach. And like I tell you guys almost daily, I know I'm going against the grain. I understand that. And I'm trying to give you information from the other side. And I admit, I'm in a small minority, but I am 100% convinced I am right. Because I'll use this overarching principle. If cholesterol was at the root of heart disease, we would have cured it by now. Heart disease is worse than ever. You can take statin drugs and it will, these long-term, like statin drugs have been around a long time, so we have a lot of data. And you know what they do for heart disease? Nothing. Nada. Because they're not fixing the problem. Okay? Now, what clogs up your arteries? One of the things is called triglycerides, 3 fat balls. Okay? So don't be confused by triglycerides. What do they mean? They're fat balls traveling in your bloodstream, and they come from fat? No, they come from sugar and crappy carbohydrates. So when triglycerides are high and HDL is low, that's not good. Okay? I drove by a gas station yesterday, or was it Saturday? They were delivering gas. Okay? You know those big tractor trailers? And there was 2 tanks. Okay? A truck with 1 trailer and then hitched on the back of the 1 trailer was another trailer full of fuel. Okay? When I see that, I think cholesterol. Okay? Why? Because HDL cholesterol has 2 wagons. It doesn't, but for illustration purposes. 2 trailers. HDL cholesterol and LDL, they transport hormones. You need cholesterol to transport your hormones. You need cholesterol to absorb vitamin D. Your brain's made up of cholesterol. Every cell in your body has got cholesterol. but they made it the boogeyman. So HDL, okay, high density lipoprotein, HDL, you want that to be high, higher than your triglycerides. If you want to get into the weeds, APO, small particle, large particle, I call them weeds. Why do I call them weeds? Because they're just there to confuse you. Oh, I know why I got to take a statin drug. Because what happened is research was coming out that wasn't very flattering to lower LDL cholesterol. It wasn't flattering because there was a lot of studies showing, what? LDL, you can hammer it low, but that's not going to save you from heart disease, said the studies. So what did they do? Oh, well, yeah, but what if you got APO? What if you got lipo, the small particles? So that's what they did. Confusion. Why? So people will stay on statin drugs. But the key isn't LDL. The key is HDL. You want it to be higher, or at least equal, to your triglycerides, TG, fat balls. And remember, your HDL cholesterol has two trailers on the highways and byways of your blood vessels. What are they doing? One of the trailers is delivering your hormones. I tell you, it's one of the reasons, especially women, that they have trouble with their hormones because they don't eat enough cholesterol. And cholesterol is only found in the animal kingdom in terms of food. And you hear it and hear it and hear it. Vegetables, veggies, veganism, vegetarianism. It's the best thing for you. No, it's not. I'm sorry. That might offend some people. I'm not here to offend people. I'm here to tell you the truth. Cholesterol is not at the root of heart disease. Because if it was, we'd have got rid of it by now. I've been preaching this, guys, for 50 years. They've been trying to tell me when I was in school that cholesterol was bad. Says who? Okay. Now again, a little disclaimer. This is my opinion. I'm giving you information. You decide. God gave you a brain. Use it. Okay? Use it. So, that's what you're looking for. You want the exact numbers? Get my book, Sun, Steak, and Steel. Get our book. I tell you about all the blood tests that I like. Okay? I really want you to be able to look at your own blood work. You see, for years, people didn't know how to interpret any of that stuff. It looks like Greek to most people. To the lay person, you read up, you get your blood work, and my word, especially when you get into the lipids, like it's so confusing. What does it all mean? Okay. So here's what I want. I want your LDL to be high. Not low, high. They're showing LDL cholesterol, okay, the so-called bad guy. The higher it is, the more your immune system works. I always tell people, you want to die young? Do you? Okay. Well, then lower your cholesterol. You'll die young, but I told you this before, but there used to be a commercial, okay? And it was a fireman coming down the fire pole at the fire station. And he was so excited. And he got down to the floor where all the rest of the firemen were, and he was giving them high fives. I lowered my cholesterol. Okay? Sponsored by the statin drugs, Lipitor, Crestor, Zocor. Anywho, okay? So what are you looking for? Look at only two things. What is your triglycerides? They should be low. Okay? Look, there's ideal, but I don't so much care about that. I want it to be lower than your HDL cholesterol. That's the ratio. That's what I'm looking for. Okay? And I don't get into the weeds with people. Okay. Got the memo, Deb? Okay. And now, let me see, Karen, I think there's one more. I better answer that too. That was Karen asking about the risk factors. And here's Linda, okay? This is, again, it's a good question. My husband has had a mild heart attack and 2 more stents. He is on more medication and the doctor insists that he takes them because more arteries will plug again. Says his LDL is too high. See? Look, Linda. Linda, listen. Listen, Linda. Look. Your husband has had a heart attack. Every cardiologist, well, I can only speak for Canada, okay? I can't speak in the United States. They don't even have a choice. According to their College of Physicians and Surgeons, they better put you on, I know that for a fact, guys, a statin drug to lower cholesterol, because otherwise they'll lose their license. If something never happened and you sued your doctor, the insurance, his malpractice wouldn't even cover him. That's how ingrained the whole cholesterol thing is. So, Linda, I'm not telling you. I just, first of all, your husband's not my patient. I used to see a lot of patients with heart disease and heart attacks, and I tried as much as I could to work with the doctor. And I was big, first of all, no matter what, Linda, on getting your husband's diet changed. Because that's what I did. Because I would try and explain to them, look, put the medication over here for a minute. You have to eat anyways. What is the best way to eat so your triglycerides don't go up? And I don't care about LDL. And your HDL goes up, but your triglycerides go down. I'm going to show you how to eat. And guess what it was? The reset. Lower your carbohydrates. Cut out the sugar. What does sugar do? Well, sugar is very toxic in the bloodstream. It damages blood vessels. If you don't believe me, ask a diabetic. And there was a study. I don't want to go through my notes right now, but I know I have it in this notepad. I know for a fact. I just don't want to have to go through it. But I would go through it with you. That shows anyone that's ever had a heart attack, to some extent, is already a diabetic, even though the diagnosis is not there. It's always related to blood sugar. I got to get you the study, okay? But like I said, I don't want to go through my notes. It'll take me half the program. But I will bring it to you again, okay? Very interesting. Metabolic syndrome. So I would change that. Never mind the meds. The meds, that's between you and your doc, your husband and his cardiologist. Okay? But I would change the food. That you can change. Okay? And I would have him on, again, protocol for heart, even with the med. If he's on statins, he needs to be on CoQ10, ubiquinol. 100% for sure. Everybody, even physicians, maybe some of them don't know because they don't read, but if they read, they know one thing for sure. Statin drugs destroy CoQ10. And why is that important? Because CoQ10 is a substance your body makes, your mitochondria need it for those battery packs in your muscles to work properly. Statin drugs destroy CoQ10. They destroy that pathway. So at least beyond CoQ10, ubiquinol, not ubiquinone. And I would have them on Navitol. Why? Opens up blood vessels, blood supply, blood supply, blood supply. I would have high DHA, lubrication, anti-inflammatory. Okay. Thank you, Deb. And who else was asking? Karen and Linda. I got 3 in 1 today. Was there anybody else? I didn't see it. Susan. How are you, Susan? In the past years, I went to have blood work done. I was told not to eat anything past midnight, even not to drink water until the test is done. Now I'm told by my doctor's office it doesn't matter. Well, it depends what testing you're doing, Susan. You can't do a fasting insulin. Obviously this time, Susan, they're not doing a fasting insulin or fasting glucose. Because if they said it don't matter, they're not doing those. It's just what they ordered. It's not one doctor's office is saying don't eat and drink, and the other one says eat and drink. It depends what test they're ordering. Okay? You can go get an insulin test done, but if you don't do a fast, you're never going to get an accurate reading of your insulin. Okay? So it depends what test they ordered, Susan. That's why they confused you. Because they want to, if they want to get a fasting insulin, which I love, by the way, okay? It makes a difference. Now, A1C, it doesn't make a difference so much because they're doing an average of your glycated hemoglobin. Okay? But I like the fasting blood work better, for sure. Especially when it comes to metabolic syndrome. Thank you, Susan. Francis, my friend, has neuropathy. Side effects from chemotherapy. Yep, join the cast of millions. They get neuropathy. Chemo is very damaging. Here's what I did with my patients for years, B12, and they were always low in B12. Always, always. You go through chemo, you are hammering your B12. And B12 is a nerve vitamin. I liked it to combined with pine bark, Navital. Why? Nitric oxide, blood vessels. So you need blood supply for your nerve supply. Okay? You need blood supply for your nerve supply. I like the combo of both those things, B12 and Navital, okay, for neuropathy. Okay, who else here? Let's get to the next question. That was Francis, and thank you. Nancy. Tinnitus. Well, I talked about it many a times. No fun under the sun. Okay? I used to tell my patients this for tinnitus. Okay? Again, itis. Tinnitus. Ringing in the ears. Middle ear problem. Nerve. Blood supply. I just go back to the same thing. I used to get patients and I said, look, give it 2 months. If it doesn't work in 2 months, it's not going to work. But I used to like that combination of B12 and Navital. Okay? I just found for tinnitus, it was the best thing because, again, blood supply, nerve supply. Blood supply, nerve supply. High DHA. Lubrication. But it doesn't always work with tinnitus. Sometimes tinnitus is chronic and you got to live with it. And it ain't no fun, but you try everything you can naturally. Okay, and then Nancy was asking about what supplements and the amount would you subscribe for dry macular degeneration. Well, listen, anytime it comes to the eye, what is Dr. Martin protocol? Eye circulation, blood supply. So, pine bark and DHA. Those two, lubrication, blood supply, blood vessels. That's what, and that's important in your middle ear too, but it's even more important in your eyes. Macular degeneration, diabetic retinopathy, cataracts, glaucoma, circulation, circulation, circulation. Okay? Circulation, circulation. So I love that combo of Navital. And I mean, there's tens of thousands of people would testify to the protocol, the Martin Clinic protocol for that. Tens of thousands. And I even convinced some optometrists and ophthalmologists, if they were listening. They're not Linda. They don't often listen. But if they do, I said, try it. You'd be amazed what happens. Okay, that was Nancy. Jeanne, is it okay to take 1 drop of vitamin D in the morning with my coffee? Why not? Okay? Because I heard. Jeanne, you heard wrong. You heard wrong. Listen, every week I have to answer a question about the bad things about coffee. I read. I heard. Okay? There are people who are out to get coffee. They can't stand it. I had to defend coffee for 50 years. Dr. Martin, it's too acidic. No. Dr. Martin, it's a diuretic. No. Coffee's bad if you take it with certain supplements. No. There's nothing negative about coffee. I used to say this for years on my radio show, 150 studies. Now they're over 300 on the importance of coffee. Why do I call it the real vitamin C? Because it is. It beats ascorbic acid every time. Head to head. Do I like the other vitamin C, ascorbic acid? I like it. Okay? I like it. You want to eat an orange? Eat an orange. Don't drink it. You'll get vitamin C. Have a steak. You'll get ascorbic acid. Okay? You will. In a steak. But guys, it's a gift. It's a gift. I say, I'm handing you a gift. Enjoy it. Don't even feel guilty. Don't let anybody tell you it's a diuretic, because it's not. Now, you got to drink water too, though. Okay? When I put people on the reset, I ask them a question. Do you like coffee? Oh, Dr. Martin, I love coffee. Do I have to give it up? No, I want you to drink it. I'm making you drink it. What about tea? What about it? It's not coffee. It's not near as good for you. I'm sorry, because it ain't. But you want to have a tea? I'll let you have it. I feel sorry for you. Some people don't like coffee. What can I tell you? But it's not true. All the negative they say about it, it's not true. There are so many positives. Drink it. Enjoy it. And then here's me on the reset. You're going to drink coffee. Do you like it? I love it. It's free. You like water? Men. Nah. Well, you're going to drink that too. Because you need to drink 2 liters of it. 64 ounces every day, 7 days a week. No days off. Drink water. I don't like water. I said, suck it up, buttercup. You'll like it in 1 month. You'll thank me later. Now go home and drink water and shut up. Well, I didn't quite say it like that, but just about. You'll thank me later. I said you got blood as thick as molasses. You know what's more important for heart disease? Is dehydration more important than cholesterol, okay? You're stinking dehydrated. You know how hard that is on your heart? It's got to push molasses through 60,000 miles of blood vessels. And the vast majority of people walk around, they're dehydrated. Because they don't drink water. Oh, yeah, but Dr. Martin, I eat some watermelon. What, that ain't water? It's watermelon. You're eating. I didn't say you couldn't have it. I'm just saying that don't count as your water, okay? Okay. So Jean or Jen, I think it's Jen, you can take your vitamin D. I did this morning. See this here? I took my vitamin D this morning with my coffee. And I know it works. You know how I know? Because I get my blood work done. I get my dehydroxy vitamin D done. Okay, Mary, what is the cause of high bilirubin in the liver? Well, fatty liver, cirrhosis of the liver. If you got high bilirubin in the liver, you got trouble. You got liver trouble. And you better do the reset and empty that liver. The good thing about the liver, it's very regenerative. Drink water and eat fat and lower your carbs and you'll empty your liver. Okay. Mary, I like curcumin for liver too, by the way. Curcumin is so good for your liver. Okay? It really is. Stephanie, did I answer this? Can you take quercetin 2 a day long term? Why not? Why not? I love quercetin. Okay? Quercetin is such a powerful antihistamine. It's a powerful antioxidant. I love quercetin. So good for your lungs and your sinuses, and quercetin is good. Quercetin's good for your liver too. Okay? I love quercetin. Okay. And does it damage the liver? Nah, it don't damage your liver. It helps your liver. I'm taking aged garlic as well. Good for you. Okay? I'll tell you what's better than aged garlic for your blood pressure is Navital, pine bark. But you keep going. You keep going, my dear Stephanie. Okay, I think I'm done. Joanne's asking about a neuroendocrine cancer. It's a rare cancer, yep. How is it different? Well, just trying to think. A neuroendocrine cancer. It's more genetic, very rare. I still treat it the same way. Okay? You want... Okay, let me just give you quickly a protocol for cancer, okay? Mine. Negative, positive, okay? Take away sugar. Cancer needs sugar. It needs fuel, and it loves sugar. It's ravenous. Stop it, okay? Negative, take away sugar, add steak. Okay? Why? Because it'll build your immune system. It doesn't feed the cancer. You got to eat anyways. A steak a day keeps the doctor away, not an apple. Okay? I mean it. Okay? I'm very, very, very big in the protocol on vitamin D. Get your blood work, vitamin D. This is really important. And get your blood levels of vitamin D optimized. Okay? That's my protocol. Optimize vitamin D. In the United States, 80 to 100 ng/ml. In Canada, it's 200 to about 250 ideal in there. Of NMOL-L. You want to be confused? Look at blood work. Okay? It's the way they measure it. They measure it one way in the States and the other way in Canada. Okay? Anyway, I'm big on cancer protocol, curcumin. Okay? There's a lot of studies. Really good. High DHA, tumors. There hasn't been a lot of studies on DHA, but oh boy, a couple of them that have come out are really promising. Okay? Now, there's others. I like to get rid of fungus. That's why I'm big on probiotics. Because I believe that almost every cancer is fungal. It's yeast. Some people believe it's parasites. Well, then you add oil of oregano too to that protocol. Whether it's fungus or parasites. Okay. Did I answer this the other day? Maybe I didn't. Sandra. Okay, let's try and get this done. Oh, Lori, my friend is always bloated, loves drinking milk. They're not listening, Lori. Is your friend a man or a woman? He, it's a man. Surprise, surprise. He's not listening because he's a Larry that doesn't listen. Not unusual for men not to listen. Okay? I like milk and I'm gonna drink it no matter what you think, right? I remember I had a cancer patient one time, okay, in the office. I said, I want you to quit drinking Pepsi. Why? I said, you're feeding the cancer. Said, I'm never going to stop my Pepsi. It's not worth it, he said. I said, well, I can't help you. Okay, always bloated. He also eats almonds, pistachios, walnuts. I told him you're not a squirrel. Lori, you're so smart. I suggested he stop for a month and see how he feels. Well, I'd get him off all the milk and the pistachio and all the extra fiber that he's eating. Overrated. Okay. Sandra, painful scalp. Yeah, could be a nerve thing. Gum lines and teeth. Yeah, you could be low in B12. It may be fungal. There's a lot of things. I'd look at leaky gut too, especially if it's in the mouth. Joanne, psoriasis, hand, scalp, and foot. What do I think of biologics? I don't know. I don't have a lot of experience with it. Here's what I know. Leaky gut, 100%. You better fix that. You got an overgrowth of yeast coming out the wazoo. That I guarantee. So, I'm not going to give you too much on biologics because I think they're targeted therapy, immunotherapy. I'm not against it. It's just I haven't had a lot of patients that have experienced those things for even to give me a real educated answer for you. But I know what I do. Okay. I think I got everything here. I think I do. Okay. Okay, guys, we got a great week. We got some amazing studies that have come out. I'm way behind on reporting on studies, but we'll try and catch up this week, okay? We'll try and catch up the rest of the week. Okay, guys, send your questions in, info@martinclinic.com. If you don't have the book, Sun, Steak, and Steel, it's available in Canada only right now. And what else was I going to say? Oh, Rebuild Your Temple. Okay, thank you for making that such a wonderful success. And if you haven't got a copy, get a copy. Okay, we love you guys. Talk to you soon.